Welcome back to my channel. In this video, we will be looking at metabolism in pharmacokinetics. This is a topic that comes up constantly in pharmacy practice and in exams. So today, I'll be discussing exactly what metabolism means in this context, the two main phases involved, and also why understanding this actually matters when you're dealing with real patients. So metabolism, when we talk about it in pharmacokinetics, simply refers to the way the body chemically transforms a drug once it's inside you. And the whole point of this process is to take a drug, which is often not very water-soluble, and turn it into something the body can actually get rid of. Because remember, the kidneys need water-soluble substances to excrete them properly, so if a drug just stayed in its original form, your body would have a really hard time clearing it out. Now, this transformation mainly happens in the liver, but keep in mind the gut wall, the lungs, and even the kidneys themselves can play a role too. So with that definition in mind, let's break down how this actually happens, because metabolism isn't just one step. It's usually described as two phases, phase 1 and phase 2. So first is phase 1 metabolism, and phase 1 simply means the drug structure gets modified, usually through oxidation, reduction, or hydrolysis. And the most common of these by far is oxidation, which is carried out mainly by your CYP450 enzymes, so things like CYP3A4 and CYP2D6, these are the big players you'll hear about constantly. What's happening here is the enzyme is either adding an oxygen-containing group or removing hydrogen, and the goal is to expose or introduce a functional group, so something like an OH, an NH2, or an SH group, and this makes the molecule a little more polar, a little more ready for the next step. Now here's something important to understand. Phase 1 metabolites are not always harmless. Sometimes they're still active, sometimes they're actually more reactive or even toxic than the original drug. So this phase is a big focus when it comes to evaluating drug safety. Now once a drug has been through phase 1, or sometimes even without going through phase 1 at all, it can move into phase 2 metabolism. And phase 2 is essentially the conjugation phase, so this is where the body attaches a small polar molecule directly onto the drug or its metabolite. The most common version of this is glucuronidation, so attaching glucuronic acid, but you'll also see sulfation, glycine conjugation, and acetylation depending on the drug. And the key difference here compared to phase 1 is that phase 2 reactions almost always inactivate the drug, and they almost always make it significantly more water-soluble, which means it's now ready to be excreted, usually through urine or bile. So think of phase 1 as modifying the molecule, and phase 2 as tagging it for removal. So now that we understand the two phases, let's look at why this actually matters clinically. And there's really two big factors here: age and genetics. Starting with age, older patients tend to have reduced phase 1 metabolism, so those CYP450-mediated reactions slow down, and this means drugs that rely heavily on phase 1 can end up with longer half-lives in elderly patients, which is a huge consideration when you're dosing. Phase 2 metabolism, on the other hand, tends to stay relatively preserved with age, so that's actually useful to know when you're choosing between drugs. And then genetics plays a role too, similar to what we've talked about before with genetic polymorphism, because people can be poor metabolizers or extensive metabolizers depending on which CYP enzymes they express more or less of, and this directly affects how much of a drug is actually available in the body. Now, before I conclude this video, I just wanted to clarify something, because this trips a lot of people up. Understand that for regular drugs, metabolism through these phases usually reduces the drug's activity. That's the whole point. It's the body deactivating and preparing to eliminate it. But this is not the same for prodrugs. Prodrugs are inactive when they're administered, so it's only after they go through metabolism, usually phase 1, that they actually become active. So in that case, metabolism isn't reducing the effect, it's creating it. And that would be the end of this video. Hopefully, I was able to break it down in the easiest way possible for you to understand. If this video was helpful and you learned something, please make sure to hit the like button, subscribe, and leave any questions or comments down below. Thank you for watching this video, and take care.